And I'm delighted to welcome up next speaker as Dr. Matthew Sawyer. Matt has worked as a GP for over 17 years in the northeast of England. He runs an environmental sustainability consultancy called SAEE Sustainability, working to improve human and planetary health. He covers sustainability issues facing healthcare, including understanding carbon emissions footprint and helping to produce roadmaps and action plans to meet the NHS net zero ambition. He has an MSc in corporate sustainability and environment management. And along the theme of where we ask each of our speakers to tell us something that might surprise their colleagues, he also has a tattoo of Darwin's evolutionary tree. So we might not delve too much into that, Matt, but if you could take us on a journey for the next 15 minutes, we'd be very grateful. Thank you.
Yeah, no, fab. Thank you very much. And thank you very much for having me. It's been wonderful to hear from people such as Georgia, and quite agree that language is vital. And carrots and sticks, I don't think I'm going to mention either of those either. Next slide, please. So we've actually had some questions in the first session about health and public health. And this is really trying to demonstrate how we as individuals, we as communities, we as a population are impacted both directly and indirectly from motorised road travel and transport. And actually, we can sometimes see the personal impact ourselves if we've got underlying conditions such as asthma. We can sometimes taste the air pollution. But we don't always get to see some of the cancers that are caused by the particulates, the heart disease, the heart problems, the strokes, the early onset dementia and depression, the worse exam grades in school children. But we do sometimes see the indirect impacts from road accidents, but we don't always see the lack of physical activity that results from us sitting in our cars. And actually, it's also the poor accessibility of services. So, for example, a third of people who are in the lowest quintile of the population by income don't have access to a car. And these are the ones who most often need healthcare, for example. So how are we going to sort of square some of these circles? How are we going to be able to provide high quality healthcare, but without some of the harms that we can see that motorised transport has? There are a lot of health professionals who are very concerned about the health impacts from road transport, and I'll talk about those in a little bit. Next slide, please. But actually, I want to be positive, and I want to talk to you about a drug that I have invented that will reduce heart disease and strokes by a third, and diabetes by a half, some cancers by a half, Alzheimer's by 45%. It also reduces anxiety and depression, and it doesn't create air pollution or greenhouse gases, and it strengthens neighbourhoods and communities. If I had a drug that did all of that, I think I'd be an overnight billionaire. But of course, it isn't a drug that does this. It's walking. So the question is, how can we benefit the health of the people across the countries and the communities that we live in and the whole population by getting them to do more of things like this, more active commuting and less travel and transport and commutes by fossilised fuels? Next slide, please. So I've worked in primary care for about 20 years or so, and each day at the moment this year there are about 1 million appointments with general practice and practitioners and care staff within primary care. And about 70% of these are face-to-face, which means that there is a lot of travel from the population. So this is 700,000 people travelling every single day. And cumulatively across the whole of the health service, this is about 9.5 billion miles of road travel. And this is including not just the staff and the patients, but also the supplies and the supply chain. And overall, this is about travel contributes about 14% or so of the NHS total emissions. Now, actually, the NHS back in 2020 was the world's first health service to announce a goal to become net zero. And actually, the ambition is to become net zero by 2045, which feels like a long way off. But actually, there's some interim targets where there's an 80% reduction by 2030. And actually, we can start to see that if the NHS is causing this much travel, or is there's this much travel within the health service, it's actually contributing to some of the health conditions that it's trying to treat. Next slide, please. So there's a lot of co-benefits of travelling differently, of being more active. And I was going to talk about this diagram, but actually Professor Berners-Lee has talked about it. This is, as he mentioned, from his book, and looks at the number of minutes of life lost in different situations, whether it's rural or urban, and by different vehicle travel. And actually, we've made use of this and started to do travel surveys at GP practices. So we can ask each member of staff how they travel, what sort of vehicle they're in, and we can start to see that cumulatively, this is one practice, for example, this is about 250,000 miles travelled each year by the staff. And we can calculate the number or the amount of greenhouse gas emissions. I'm particularly interested in carbon footprints and greenhouse gas emissions. It's about 50,000 kilos each year. But it's also taking away over 5 years of life of the community that they're there to look after. And this is for one practice, and there's about 6,500 practices in the UK. Obviously, all of them are different in terms of geography, in terms of size, so they're not all going to be exactly the same as this, but this is just a one practice example. And we did exactly the same with patient travel. We know where the patients live, we know where the practice is situated, we know how far they are travelling to their appointments. And again, actually, we can amalgamate these and know that the cumulative total is about 150,000 miles, 25,000 kilos of greenhouse gases, and about 3.5 years of life being lost. So actually, for this one practice, in 1 year, they were taking away about 8.5 years of life of the community that they were there to look after. This is not the reason why people went into healthcare. We did not become doctors and nurses and clinicians and admin and management because we wanted to cause harm to the population. So actually, this does not sit comfortably with a lot of us. Next slide, please. So how do we make a difference? How can we make even a start on some of these big numbers, these impacts that we're having? Well, actually, within healthcare, we can do patient surveys, we can do staff surveys. And so we ask people on how they travel on their commute, which is a very simple and well-used approach. But we also ask, how would they like to travel? On a perfect day, what would be your preferred mode of travel or transport? And then we asked about what stopped them from doing it or what would enable them to do it. And for me, this is where the language becomes important. The enablers are particularly important because it's looking for the positives. What would help you choose this mode of travel rather than what is stopping you from doing it? Next slide, please. So this is some of the results, and so we could have a look at staff within general practice. This is a nationwide survey based on about 400 or so respondents, and this is their round trip. So this is their daily commute. So we can see that there is between 5 and 20% of staff who have got less than a mile commute, and surprisingly, 40% of those drove. Now, this is less than a mile in total, and yet they were still driving, or a significant proportion. And we asked the same question of how do you currently commute, which is the pie chart in the bottom right corner, and the red is car travel, or people traveling on their own in a car. And again, this was about 3/4 or so of the people who were traveling 5 miles a day were doing so by car. But for me, the interesting one was the one that is in the top right. This is how would you like to travel? So you don't have any other commitments. You don't have to drop the kids at school. You don't have to pick up your mum. You don't have to do anything else. No shopping, nothing else. How would you like to travel? And even those who had up to a 10-mile a day round trip, the amount that actually said, I would like to travel on my own in a car was just over 40%. So suddenly, giving people the options and permission to do something different, we got a completely different response. So we can start to see that there are aspirations within healthcare staff, within primary care staff, to do something different to what they are at the moment. So this is starting to give us an open door. This is starting to say there are some things that if we put in place, what would enable people to do things, whether it be walking or cycling or public transport or e-bikes or traveling with other people, to do it differently. Next slide, please. And we asked the same question has been asked of patients. And so it was, how do you usually travel to your GP surgery? This was from Hull, and about 45% of people said that they currently travel by car. When you ask how would you like to travel, that falls. So a quarter or so of those people who currently go by car actually would like to do it some other way. And so this is starting to have a look at what sort of things might be available to enable that, to allow that to happen. Next slide, please. So one of the things that people, when we ask the question, is that they're not always sure what the most impactful action is going to be. What sort of thing is going to make the biggest difference? And so there's 10 or so different actions on the screen here, and I'm not going to do a poll, but I'm just going to ask you to have a think. Which one of these do you think would be most impactful? Now, I appreciate that on there is one less flight, which is medium haul. I do hope that nobody here is flying to work. That would be rather disastrous. But actually, when you ask this question of people, they may well get it wrong, or may well think that the actions that they're doing are more impactful than they actually are. So next slide, please. And the answers actually come from a very useful research paper that was out, I think it was last year, looking at which actions have the most impact. And so there are some that are directly relatable to the daily commute. So if we cross out the flights, which are sort of third and fifth on this list, that actually living car free is most impactful. If we are traveling, it's doing it in a battery electric vehicle. That makes sense. Shifting to public transport, really, really important. Less car travel and transport, and so on down the list. And so actually, we can start to use this within practices to say, how can we start to offer services, provide healthcare without the need of having a car? Next slide, please. And so one of the things that is already happening with the adoption of things like digital technology. So we have the NHS app, and the NHS app is there to reduce, but it wasn't specifically designed to reduce travel to GP practices, but it's actually reducing the number of car journeys each month, because people can now order online or through an app rather than having to go down to their practice. And it used to be that the practices would have a little wooden box. You'd put your repeat prescription in. Bob's your uncle. A few days later, it magically appeared at the chemist. Well, actually, we can skip out some of that travel step. So we can do this with no car at all. Next slide, please. Lift sharing is actually something which is increasingly important. So this was a practice I was doing some work with. They had a concern about their car park space, which is really where this came from. And actually, we did a staff survey and effectively plotted where everybody lived on Google Maps. And the practice manager said, oh, there's 4 staff that live all the way over there, so about 3 miles away from the surgery. But I know that they all travel in separately. I know what cars they come in. And this was really got the mind thinking. And the question was really posed to the staff, would you like to travel together? And they actually leapt at the opportunity, and they said it would give us such joy. It would give us a joyful commute if we could share, because actually outside of work, we spend time with each other, go on holiday with each other, our kids see each other, we have a great time, but we've all got to travel separately to work because of our start and finish times. It's the shift pattern that is stopping us from lift sharing. So a couple of tweaks later, suddenly all of the staff started at the same time, finished at the same time, and they came to work together. So the outcomes was really that there was more happiness, there was more chat and gossip, there was more camaraderie, there was a rise in morale. They had an enjoyable commute. They had more money in their pocket because they were spending less. And the practice was happy because it freed up space in the car park for the patients to park, so there were less complaints. For me personally, I was delighted because there was better air quality because of the cars off the road and fewer greenhouse gas emissions, and that gave me joy. So it was a much more joyful way of doing things. Next slide, please. Part of it is about how do we influence others. So this was a GP at a practice in the southwest of England, and he said that he went and spoke to his practice about climate issues and the things that were concerning him, what was important to him. So actually, the thing that gave him most satisfaction, and note that word satisfaction, it was satisfying that he influenced somebody else who then started cycling to work. So that 1 mile that 1 mile commute to work that had been in a car was now done by bike. And so we can start to see that there are ways that we can use our influence to affect others by talking about it. I can talk to you about surgeries having e-bikes for home visits and how some e-bike organisations have month-long loans so that it can be affordable for staff. There's a whole host of things that are happening. Next slide, please. But for me, one of the important things was looking at the enablers. How are you travelling at the moment, and how would you like to travel, and what would enable that to happen? So there were quite a few things that came up, unsurprisingly, that said, this is what's stopping me. If this was different, I could then do something. So things like bad weather. Well, of course, none of us can change the weather. We can change climate over a more considerable length of time, but not weather in the short term. But we can find protective clothing. We can't shorten routes, but we can find those that are least hilly, those which are shortest, those which are quietest for people to be able to cycle on. And we just heard from Georgia about people either not having a bike or not being able to cycle, and actually some of the options and some of that camaraderie and coming together to be able to do things as a group to make a difference. Some people complained that they weren't fit enough. So actually there was a group of practices that said, well, what we're going to do is we're going to get people to have a walking competition, see which practice can do the most number of steps in a month. And all of the staff can join in. And it was amazing how many staff across the patch, across these 11 practices, took part. And there was real competition between the practices to who could walk the most. So people started walking to work, they started walking at lunchtimes, they started doing all sorts of let's walk to Mount Everest and back in the weekend or something crazy. And suddenly people then no longer had the excuse of not being fit enough, because actually they could see that they could do it. And then there were various infrastructure or practice things that could be put into place as well. So things like access to cycle racks and secure parking. Next slide, please. And really there were a number of different groups of feedback that came from talking to staff. So it was things like the infrastructure or the system problems of looking at public transport or bike spaces upon public transport or cycle lanes being available. Some of it was around the organisation or the institution, and were they making life easier? And some of it was over those personal or behavioural issues about looking at the co-benefits of active travel, for example, or if you see somebody else cycling. One of the things I used to love doing was doing home visits on my bike and turn up and knock on the door, being in cycle gear with a cycle hat, and people would say, oh, I'm waiting for the doctor. Well, I am them, but you cycled. But why wouldn't I cycle? And so actually it can give you that feedback because people are now more visible. Next slide, please. So this is taken from a practice in Brighton that put together a travel plan of all of the different things or a host of different things that they could do within their practice to try and promote more active travel and the variety of opportunities to try and target the different enablers for different people. So whether it be the cycle maps, whether it be the cycle to work scheme, whether it be the cycle training, etc. And so for me, it's absolutely, as Georgia said, it is not a silver bullet. It's not one thing's going to fix all. It's going to be lots of different things, and it's different things for different people, and it's how to make everybody feel enabled to do it. And final slide, please. And so for me, it's absolutely the secret to good health is not rocket science. It's about a healthy lifestyle. But for me, it's really, really important to have those healthy habits engineered into daily life and having the infrastructure around us to allow those to happen. And thank you very much. Look forward to being on the panel shortly, and back over to yourself, Mark.